5 vitamins for nerve damage repair. Nerve damage, also known as neuropathy, affects millions of people worldwide. It can be caused by diabetes, chemotherapy, injury, infection, autoimmune disorders, and nutritional deficiencies. The symptoms depend on the type of nerves affected, but may include numbness, tingling, prickling sensations, sensitivity to touch, muscle weakness, pain, and difficulty walking or handling objects. While medications can help manage these symptoms, the treatment options for regenerating damaged nerves are limited. However, emerging research shows that certain vitamins and supplements may help repair and regrow nerves. In this video, we'll explore the science behind using vitamins as a natural way to treat nerve damage and improve neuropathy symptoms. First, we'll examine the important B-complex vitamins, B12, B1, and B6. Then, we'll cover other nutrients that aid nerve health, like alpha-lipoic acid and vitamin D. We'll discuss the best dietary sources for maximizing your intake of these vitamins. We'll also explore the appropriate supplemental doses that may offer regeneration and relief for damaged nerves. Please work with your healthcare provider to identify any vitamin deficiencies through lab testing and seek their advice. 1. Vitamin B12. Let's dive in with vitamin B12. This water-soluble B-complex vitamin plays a vital role in the health and function of nerves. It helps build the protective myelin sheath that surrounds nerve fibers like insulation on electric wires. This myelin sheath allows nerve impulses to transmit quickly and efficiently along the nerve pathways. When you become deficient in vitamin B12, the myelin sheath breaks down. This makes nerve signaling slower and less efficient, and can cause numbness, loss of reflexes, and, eventually, nerve degeneration. B12 deficiency is common, especially in older adults. It's estimated that anywhere from 10 to 30% of people over 50 lack adequate levels of this essential nutrient. The recommended daily intake of B12 for adults is 2.4 micrograms, but doses utilized to treat neuropathy are often much higher, in the range of 1,000 to 2,000 micrograms per day. This is due to the poor absorption of B12 from foods and supplements as we age. The best dietary sources of B12 are animal products like meat, fish, eggs, and dairy. But this may not be enough, especially if you don't eat these foods regularly. Vegetarians and vegans are at particularly high risk for deficiency. Supplements can be very effective if you can't get sufficient B12 from your diet alone. Methylcobalamin is the most readily absorbed and bioactive form of supplemental vitamin B12 for nerve regeneration. It helps regrow the protective myelin sheath and has been shown to reduce neuropathy symptoms like numbness, pain, balance problems, and nerve degeneration. Talk to your doctor about testing your B12 levels, especially if you're at risk for deficiency. Work with them to determine the dosage and type of B12 supplement appropriate for your needs. Maintaining optimal levels, whether through diet, injections, or supplementation, is key for supporting healthy nerves and neurological function. 2. Vitamin B1. Another important B-complex vitamin for nerve health is thiamine, also known as vitamin B1. Like B12, thiamine plays a critical role in nerve conduction and signaling. It's needed to form key neurotransmitters that relay messages between neurons. Thiamine deficiency has long been linked to nerve damage and peripheral neuropathy. Those with diabetes, alcohol dependence, autoimmune disorders, kidney disease, and malnutrition are most at risk. Nerve damage and neuropathy stemming from lengthy thiamine deficiency can become permanent if not treated promptly. Benfotiamine is a supplemental form of thiamine that is especially beneficial for nerve health. It has superior bioavailability compared to regular thiamine. Benfotiamine can more readily penetrate cell membranes and convert into the active form of thiamine in nerves and other tissues. Multiple clinical studies demonstrate benfotiamine can improve neuropathy symptoms and nerve conduction and reduce neuropathic pain in diabetic patients. Common dosing is around 300 milligrams per day. But speak with your doctor to determine the appropriate amount based on your health and thiamine status. Dietary sources of thiamine include whole grains, seafood, beans, lentils, spinach, peas, and sunflower seeds. But food may not give you enough, especially if you already have nerve damage. Taking benfotiamine supplements under medical guidance can help repair neuropathy. 3. Vitamin B6. Let's move on to vitamin B6. Also called pyridoxine, B6 is essential for healthy nerves and brain function. It plays a key role in synthesizing important neurotransmitters for signaling between nerve cells. Vitamin B6 also aids in maintaining the myelin sheath that protects nerve fibers. Low levels of B6 are linked to peripheral neuropathy and nerve inflammation. Uncontrolled diabetes is one of the common causes of vitamin B6 deficiency. Several studies demonstrate the benefits of vitamin B6 supplements for improving neuropathy symptoms and nerve conduction in people with diabetes. Doses of pyridoxine, around 100 to 200 milligrams per day, over 3 to 4 months, seem most effective. However, extremely high doses over long periods can cause nerve damage. The recommended daily intake for B6 is 1.3 to 1.7 milligrams per day for adults. Food sources include poultry, fish, starchy vegetables, fruit, nuts, and grains. Considering the low toxicity risk, a daily supplement of around 100 milligrams is safe for those with existing neuropathy. But be sure not to exceed 100 milligrams daily without medical supervision. Maximizing your vitamin B6 intake through food and strategic supplementation can help nourish your nerves back to health. However, work with your doctor to find the optimal dose and duration based on your condition. 4. Alpha-lipoic acid. Beyond the B vitamins, alpha-lipoic acid, ALA, is another promising nutrient for nerve regeneration. The body makes this antioxidant naturally in small amounts and finds it in various foods. As a supplement, ALA is highly effective in protecting against and treating diabetic neuropathy. It works as a potent antioxidant that targets free radicals and nerve inflammation. This can prevent further damage. ALA also helps regenerate levels of other antioxidants, such as glutathione, vitamin C, and vitamin E. This synergistic effect strengthens the body's natural antioxidant defense system. In addition, ALA appears to stimulate the growth of neurons and nerve fibers. Clinical trials using intravenous alpha-lipoic acid demonstrate it promotes nerve regeneration and improves positive symptoms of diabetic neuropathy. When taken orally, doses around 600 to 1200 milligrams daily may relieve numbness, burning, and pain. ALA is found in small amounts in foods like spinach, broccoli, tomatoes, Brussels sprouts, and yeast. However, large therapeutic doses for neuropathy are usually obtained from supplements. Before taking high-dose ALA, talk to your doctor about potential medication interactions and side effects like digestive upset or hypoglycemia. While generally safe, get personalized guidance to ensure it's right for your situation. 5. Vitamin D. Moving on to vitamin D. This fat-soluble nutrient is an essential hormone that regulates inflammation and supports nerve function. Growing research links vitamin D deficiency to an increased risk of neuropathy, especially in those with diabetes. Loss of sensation and neuropathic pain are common symptoms. Because vitamin D is involved in nerve signaling and neurotransmitter activity, optimizing levels may help relieve these. Vitamin D deficiency is widespread, affecting over 40% of U.S. adults. Those at highest risk include older adults, people with dark skin tones, and anyone with limited sun exposure. Ensure your 25-hydroxy-vitamin D blood concentration is tested at your next physical. Food sources of vitamin D include fatty fish like salmon, fortified dairy, and supplements. But the majority of our vitamin D comes from sunlight. Just 15 minutes of midday sun exposure can provide adequate levels for most people. More may be needed based on location, skin pigmentation, and health status. Research demonstrates that supplementing with calcitriol, the activated form of vitamin D, may have protective benefits against diabetic neuropathy. Calcitriol binds to vitamin D receptors on neurons and reduces inflammation. Doses of around 0.5 micrograms daily under medical supervision may help relieve neuropathy symptoms. Work with your doctor to find the right supplemental dose and optimize your vitamin D intake through sun, food, and supplementation. 6. Other nutrients. While those are some of the most researched vitamins for nerve health, A few other nutrients also show promise for treating neuropathy. Acetyl L-carnitine. This amino acid is needed to transport fatty acids into mitochondria, the energy factories of cells. It's been shown to regenerate nerve fibers and improve sensation in studies utilizing 500 to 1,000 milligram doses taken twice daily. Polyphenol. Specific polyphenol antioxidants from green tea and curcumin may protect nerves and reduce neuropathic pain signaling. Resveratrol. Resveratrol is another antioxidant compound found in grapes and red wine that demonstrates neuroprotective effects in research. Probiotic. Probiotic gut bacteria can reduce inflammation and produce key B vitamins for nerve function. Look for a multi-strain formula with at least 10 billion colony-forming units. In closing, a growing body of research demonstrates the potential for vitamins and other nutrients to regenerate damaged nerves and reduce neuropathy symptoms. Strategically supplementing your diet with B-complex vitamins, alpha-lipoic acid, vitamin D, and antioxidants can help nourish nerves and bring them back to health. Thanks so much for watching. Let me know in the comments below if you'd like more in-depth videos on natural neuropathy and nerve pain treatments. Please like, share, and subscribe to stay up to date on the latest research on using nutrition to heal the nerves and reduce neuropathy symptoms.